There is a growing need for primary health care in Africa.
Dr. Anderson is a young optometrist whose passion goes far beyond the clinic.
And so to meet that demand, there's a scholarship set up to train young health professionals and even healthcare students, build them up so that they can always come back and impact healthcare in Africa. And so Mastercard is running a full scholarship program under the Africa Health Collaborative, and then it's across 9 major universities in the world. And I'm fortunate to have been selected to join them.
Recently awarded the prestigious Mastercard Foundation Scholarship, his journey is a proof that purpose, resilience, and vision can truly change lives.
80% of the sensations that a human being experiences comes from the visual system. A lot of people don't know that. The brain helps you to talk, helps you to walk, helps you to raise and do every other thing. Now imagine something travels along that connection and it affects the part of your brain responsible for speech. It was an eye problem, but now you can't talk anymore.
With a focus on bringing eye care and public health solutions to rural communities, he is making an impact where it matters most.
What do you think healthcare practitioners or healthcare workers should implement in this digital era to make their work easier?
Healthcare professional, if you limit yourself to the consulting room, you are doing a lot of harm, because you have that knowledge not just to prescribe medicine. You are not a prescriber, you are a health professional.
It's about restoring hope in rural communities that often get overlooked.
If you could put one sticky note on every young person, every dreamer's wall, what would you write on it? Welcome back to another episode of Dreams and Feelings podcast. I'm Julius Ansah, and today I'm joined by Dr. Anderson. Dr. Anderson is an optometrist and also very passionate about public health and then making impact in Africa's healthcare space. So today we are diving into his journey, and then we want to know the challenges that he has faced throughout his journey. He's also a politician. Yeah, he's also a politician. Yeah, he was very vibrant in student politics when he was in school. Yeah. And I'm sure you are still in politics.
Yes. Once in there, always in there.
Yeah. Thank you for joining us today.
You're welcome.
Welcome to Dreams and Feelings.
I'm glad to be here.
Okay, how are you feeling today? Well, we ask everybody that comes in. We want to know how you are feeling.
Okay.
Genuinely.
I feel good, except that I'm not so used to the Accra bustling and hustling. Yes, and so moving through town, the traffic, I'm more of rural doctor. So
Rural doctor.
I usually move without joining any traffic around. Yes, so that's the only challenge, but it's good. It's a good feeling to be here.
Last time we were texting, we were having a conversation on phone, and then we were talking about the show, this episode, and then you were like, you've gotten some scholarship, so you will be out of the country. I'm not sure that by the time the episode will be out, you will even be in the country.
Oh, yes.
Yeah, I'm not sure you'll be in the country. So I want you to talk about that.
Okay.
What is that about?
Great. So there is a growing need for primary health care in Africa. And so to meet that demand, there's a scholarship set up to train young health professionals and even healthcare students, build them up so that they can always come back and impact healthcare in Africa. And then I'm sure we'll delve into this conversation, but I've been all about public health, growing into rural communities, creating access for people. And so based on that, I got a recommendation from a colleague out there. And then the person said, what you are doing is exactly what the criteria is here. And so Mastercard is running a full scholarship program under the Africa Health Collaborative, and then it's across 9 major universities in the world. And I'm fortunate to have been selected to join the cohort that will go into the University of Toronto.
That's incredible.
In Canada. Yes, and then if I'm to brag a bit, University of Toronto is the #1 university in Canada. More like the Harvard of Canada.
That's nice.
So I'll be embarking on that new phase, that new journey to go build up my skills and then come back to impact primary healthcare in Ghana and in Africa.
Okay.
Yes.
This is not just a personal milestone.
Not at all.
a powerful investment in the healthcare of Africa.
Exactly. So for me, going out there is more of going to gather a lot of knowledge. Canada has one of the best healthcare systems in the world, actually. And so going to learn, going to understand how things work there, and then bringing it back to implement it here in Ghana, so that old woman in the village, deep somewhere in the forest, can also have a way to access healthcare. And so it's a win for Ghana, it's a win for Africa, it's a win for all of us as
talking about coming back to impact the lives of people, the people in your communities. As you said, a village doctor.
Yeah.
The people in the communities that you are in, how are you, like, how do you think this is going to help you impact the people in a way that you would actually be satisfied?
Good. So I'm happy when I hear the word village doctor. If you check me out on LinkedIn, I'm all about the village. There are a lot of people in there who do not have access to healthcare. It is that serious. When we are out here in the cities, we assume life is all rosy like we see it here, but it's a very bad situation elsewhere. And so you have facilities that we call CHIPS compounds in deep villages.
Me too, I'm from a village, so I know about
exactly. And then in there is no healthcare professional. Sometimes villagers are actually trained on the job, and then they give injections, which is very bad. Can be very fatal. And so going out there, having the experience, the exposure of seeing how a functional healthcare system works out there, and then also networking, because the work I was doing in the village was basically with NGOs. And so I was working with people funding us to go in there. But you realize it's not very sustainable. Because, for example, when Donald Trump came in, he cut off the funding that goes to USAID. And then the work that I was doing ended at once because there was no funding. And so I'm hoping to go out there to learn about how sustainable ways of rolling out primary health care in these rural communities, so that if a donor decides to pull out his funding, it doesn't mean my grandma or my uncle in there is not going to get health care anymore. And so that is how it's going to actually impact. Gathering all these experiences, exposure, networks, will come back and they will know how to go about helping address healthcare.
Okay. How did you land in healthcare, specifically optometry?
Oh, super. I like the questions that are coming in because my journey in optometry is actually from a personal difficulty. You see, I've been wearing glasses for as long as I've known. And then growing up, it was difficult to see, even when I'm at home trying to watch from the TV. And I was always fixing my books. So my parents had to take me in to check on my eyes. My teachers were complaining and all. And then I met this wonderful doctor at Akawe, Gar South Municipal Hospital, Makati. Okay. It's just Malam Junction area. Yes, and then this doctor was so nice to me. I promised myself I'll become an eye doctor.
And you are there.
And that was basically it.
That's very nice.
How I ended in optometry. Yes.
As an optometrist, what do most people take for granted when it comes to our vision? We're always talking about vision, dreams, vision, but we forget that before we get to that vision, we need vision.
Exactly. That's a good one. Yes. So you see, 80% of the sensations that a human being experiences comes from the visual system. A lot of people don't know that. And so if you are eating any food and it's going to taste good, it's because you've seen the food. It has excited you to produce saliva in your mouth, excites all your taste buds, and then you can enjoy the food.
Yeah.
And so at any point, if we lose our vision, it derails almost all that vision that you have for your life. And so it's very crucial that everyone pays attention to their vision. You can gain as much money as you need. You can do everything, but the day your light goes off, and even the Bible says that the eyes are the windows to the body. They are the light of the body. And so once it goes off, life becomes very unbearable. So what optometrists do, we detect eye care conditions, basically. And then eye care is not limited to these two balls that you see. The eye is the only organ in the human body that is an extension of the human brain. So the brain just extends itself and it forms an eye for you. So if something should happen to the eye and it travels along that extension, which is the optic nerve, and goes to the brain, then Your brain is responsible for you raising your hand,
Today
for
we are
you
learning
talking.
optometry.
I want to break it down.
Today.
So you see, your brain helps you to talk, helps you to walk, helps you to raise and do every other thing. Now imagine something travels along that connection and it affects the part of your brain responsible for speech. It was an eye problem, but now you can't talk anymore.
Okay.
You get it? It was an eye problem, but
having
you
an
can't
eye
walk.
problem can also make you like stop talking. It can make you, is it deaf?
Dumb, deaf, and dumb. So basically, once it extends to any part of the brain, and so most of the things that we do is connected with neurons, brain. Because if there is any tumor present, sometimes the eye doctor is the first person who will pick that up and then refer you for better follow-up, and we've been saving a lot of lives with the work that we do. So optometry is not just about spectacles, getting people to wear spectacles. It's about protecting the livelihoods of people and the lives of people as well.
Okay. You've gone beyond the clinic, and now you are doing public health work in rural areas too.
Yeah.
COVID outreach,
Okay.
gender-based violence campaigns,
Yeah.
and then a lot of other things. What pulled you to that side of health?
Okay, that's beautiful. I completed my GHS education in a very deep village. It's called in Kutum, so it's in the
Kutum. So I don't go to
upper Dentra West.
During my national service, we used to go there. That was one of the catchment communities of the company I was working in. So we used to go there almost every day.
So you're aware of the heavy galamsey
I'm
in
aware.
that area.
I'm aware.
Yeah, so growing up, there were almost every weekend. As kids, we didn't understand. We enjoyed wake keepings. There's wake every weekend.
Yes.
But people were actually dying. Very young people had their lives cut short. And this was because there were no healthcare facilities in that area. The painful thing is, Nkotum also had a clinic that was built in a village, but due to politics, it hadn't been operationalized. So it was just a building standing there.
Politics.
So yes, before people will be transported to the nearby clinic, they are dead. And so I realized that even though I'm branching into eye care, I had never seen an eye doctor back then when I was at Nkotum, or even within those areas. So there are a lot of people who need eye care, who need health education in these areas. And so once I started, I decided to go back. And I started as a student during COVID. Yes, you mentioned that. And then I brought university students together, transported them from KNUST to Nkotum. And we taught them how to make sanitizers. We got donations from lecturers, bought nose masks. Then we went by every home there are about 3 villages together, every home to do healthcare campaign, and then to also donate these items. And at the end of COVID, there was not a single case recorded in Nkotum. So it showed me there was huge impact from the work we did.
So that's like success for you.
Exactly. And so that motivated me then. Why not go straight into public health in rural Ghana once I'm now qualified to do that as a doctor?
What's one experience that you feel like this experience I'm never going to forget about it?
Okay, good. So there are actually 2 things. The first one is the consistency in the lack of access. And so I've traveled deep across very rural places in Ashanti region, in Bono region, in Ahafo region. These are the main regions where I did most of my work.
So your work has always been in the rural areas?
Yes. And then funny enough, it took a whole year, we couldn't finish one region. And so you'd assume, mostly when you travel on the main route, you assume that is all, but there are places, deep forest areas that people are living in. And every single community you go in these deep areas do not have healthcare access. They simply do not have. But healthcare is supposed to be a basic right.
Basic something that everybody should have.
Exactly. And this is the 21st century. And so we are saturated, doctors and healthcare professionals are saturated in towns. I feel we are too many here. So I will do my work in
most of the time. Is it they are saturated here or they want to be here?
So it's a matter of bread and butter. The challenges of sustaining your own family as a healthcare professional while you are in there is very serious, because it's not rewarding financially. For most part of it is not rewarding. Again, sometimes due to empathy that we show as healthcare professionals, you might end up spending all your little salary on paying to save lives. And then that is at the detriment of your own family. And so a lot of people would rather, let me just do either ways, I'm still taking care of people, I'm still saving lives. So I want to stay in the city.
Let's take a quick dive into leadership.
Yeah.
We have been in the hospital for some time.
Yeah.
Leadership. You've been in some serious leadership roles.
Yeah.
I know you were the SRC Speaker of Parliament for KUST. That was in which year? Was it 2021?
Yes, 2021.
And then you went on to become University Students Association of Ghana president.
Yes.
That's like a very huge achievement.
So I did way more than even that.
Mm-hmm.
So I was Unity Hall Kunti General Secretary.
Mm-hmm.
Prior to that, I was academic board chairperson for Kunti. Then I became secretary.
Oh, okay.
And then I was the Senate Speaker for College of Science. I actually inaugurated that Senate, but I had to let go for someone to take over. And then I was PRO for NUPSK and UST. Okay. And then the Speaker of Parliament and USAC presidency. Those are the major. Yes.
So let's come to the question I want to ask.
Uh-huh.
I want to know, what toll did it have on you emotionally or mentally? Because it was coming like, it was like back to back. Yeah. Like from this position, you enter this role, from this, you enter this role. What toll did it take on you emotionally or mentally?
Mentally. Okay, so first of all, it was an experience I really enjoyed. There were years where I would be holding 2 or more positions in an academic year. I did not realize the toll, as you put it, until I started my active work in public health. And then I realized literally everything I learned in there applies to what I'm doing now. It built me, especially in relating to human relations. Yeah. Exactly. Because before we go into any village, you have to go and go to the palace.
Let me come. One thing I always say is that I think every student should involve him or herself in student politics.
Definitely.
In one way or the other builds you for some things ahead.
Definitely.
Like the human relations part you are talking about.
Definitely. Yeah, because now when I enter any village and I have to go to the palace, one memory flashes in mind, and that was as County Secretary when His Royal Majesty Otumfuo said to call call us to Menshia Palace over this whole mixed hall issues. And then he posed a question to us. We had to respond, and we stood up in a wrong way where we prompted, hey, So now there's no palace that I enter and I'm not confident, because bro, you've been to Otumfuo's palace. Which other palace should give you pressure? You get it? And so it built me up, knowing how to relate to these people. Wherever I go, I know how to put my past experiences together. So for student leadership, everybody, if you have the opportunity, should actually involve it. Whether or not you feel you're a leader, at least it builds something in you.
Okay.
Yes.
Okay, let's get back into healthcare.
Okay.
You use digital platforms to educate people on our health.
Yeah.
You do that. So
yes.
I want to know from you, what do you think healthcare practitioners or healthcare workers should implement in this digital era to make their work easier?
Okay. All right. So my work in the Bono region. Now, I did a lot of radio station talks. Doma, Ahinkro radio stations, Drobo radio stations, Nkran Kwanta, Sunyane. And then one thing that I realized was, if you don't go, in this modern era that we are, people will go with the misinformation. So when you turn on your TV screen, you see a lot of people advertising concoctions that they claim one concoction can cure all diseases in the world. Exactly.
When you sit in trust.
Yes.
When you are traveling from maybe
Accra to Kumasi, yes,
there will be this drug can cure diabetes.
The same drug. What mechanism of action does it work with? You get it. So as a healthcare professional, if you limit yourself to the consulting room, you are doing a lot of harm, because you have that knowledge not just to prescribe medicine. You are not a prescriber, you are a health professional. And so using these media, social media, traditional media, radio, LinkedIn, every place that you put an educated information there, you're actually creating access to healthcare for a lot of people, because someone might just read and then now know that, oh, okay, I actually have to go and see a doctor about this. And I had very vivid examples. In Sunyane, someone will walk into the clinic. I was doing a bit of clinic work too when I'm in Sunyane. And they will say, oh, I start talking to a person, and the person will go like, doctor, are you the one on radio? Because they now realize, they recognize the voice that they were hearing. And then people actually came in because they heard some of these information out there. So social media it should be a part of healthcare now. Because if you don't do it, someone will go out there with the wrong information. And so it is our duty to come and clear the air and give the educated information to save a lot of lives.
So, talking about saving a lot of lives, what does personal wellness mean to you?
It means everything. Healthcare professionals, we are very, 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 very lazy, in quotes, about our own personal healthcare.
I think that's true.
Yes. Genuinely, I've never, and I'll confess, this is a bad thing to say, but please, no one should go and do this. I've never finished a full course of medication that I've been given. I take it 2 days.
I thought I was alone. A doctor is
wrong.
with me. A doctor is with me.
Exactly. So I take 1-2 days, and when I feel better, I stop. So it means we have to put in more efforts to take good care of our own selves. And then when you come to Ghana, for my association, which is the Ghana Optometric Association, we do a number of campaigns that actually teaches us, the doctors, how to take care of our mental health, our physical health. And so I am changing. I'm doing quite better now in taking good care of my own health.
Talking about your mental health and physical health, how do you avoid burnout in your work as a doctor?
Yeah, you've done a lot of research.
I've done a lot of research about it. Not just me, my team and I.
Oh, that's but you guys are doing amazing. So burnout is something that is very common among healthcare professionals, and then we undermine the effect of burnout. For me, I was doing 100 to 150 patients a day in the village, single-handedly. And then the normal
100 to
between 100 to 150 in every village.
That's in the village.
Yes. And then we were doing Monday to Friday, back to back every day. So this day we go to this village, next day we move, And so in a week,
your practice has always been moving from place to place. Like
yes.
You go here,
go here. Yes. So that's for all we're doing, we take a district, and then we work together with the chief farmers and the farmers. So they disseminate the information, and then when we come, people would have gathered, so we take care of them.
And that's very effective.
It was very effective. Yes, and so when you do this, you will hear sad stories. Because I saw a 13-year-old girl who was going to write BC who had gone blind suddenly. And then I checked, and it was advanced, we call something glaucoma, advanced glaucoma. Basically, I couldn't do anything about it.
So those things, is it like when you identify them earlier?
Yes, that is when
do something about
it. Exactly. So there was nothing I could do about it.
Are there cases that you identify the disease earlier, but then you still cannot do anything about it?
Oh no. So if we identify and nothing can be done, then it means the person did not take the step, any follow-up step after we had left. So we had a system where we start you on management for some of these conditions, and then we compile a list, submit to the health care team in that village. And so we had an initiative of bringing the community nurses to work with us so that they can actually identify those people. They know where they live, and then they follow up after we have left. That is what we were doing. That is a bit of sustainability that we put in place. So after seeing all these cases, seeing all these numbers, you are bound to burn out. You are definitely going to be emotional because you would be sad seeing that you can't do anything about it. Yes, and so you have to partition your emotions. There's a side for work, there's a side for home. If you don't do that, it's not going to work. And so once you step out of work, you put that behind you. If you can do something about it, you do it. If you can't, you just let it be, because that is how it's supposed to be.
I'm sure the scholarship you've gained to study in the University of Toronto.
Yeah.
From there, you are going to become or aspire to become a public health policymaker.
Definitely.
Yeah. So what do you want to change or influence in public health
Yeah.
when you become a policymaker?
Yeah. So my goal actually is to explore how to run sustainable primary healthcare initiatives in rural and deprived communities. And so I am looking at creating the platform where even without funding, we can still have access. And when you go to other jurisdictions, there are new technology in place where there's telemedicine where people they set up a unit in a village. The doctor is in Accra, but the doctor can consult while he's in Accra.
No, okay.
Yes, and it's face to face. These are all options that I'm exploring. I'm yet to come across the actual knowledge or intricacies into how it works.
Yeah.
That is why I'm fortunate to have the chance to go and study.
Okay.
But when I come back, which I am definitely going to come back, I don't plan to Japan and then decide not to come back.
We'll be ending soon, but I want to
Yes.
know, how did you secure the scholarship for the Mastercard scholarship?
Okay, so
And
basically,
it's a full scholarship too.
yes, very
incredible.
comprehensive scholarship, and I'm very grateful to God and to Mastercard for the opportunity. Now, for the scholarship, it's open for you to apply, and then in your statement, you have to let us know some of the work that you are doing, which makes you the best candidate. It's a lot of stages. You do one application, they sort out. You do another one, they sort out. You go for an interview, they sort out before you
So
finally
a lot
get
of sorting out.
Yes. For my program, which is the Masters in Health Administration, I think I'm the only Ghanaian who got into that program. Yes, but there are other programs that you have 2, 3, or 4 Ghanaians getting enrolled into. So it was basically the work I was doing in the village.
I want to ask you 2 questions in one.
Okay.
How do you stay grounded, and then what keeps you going?
Yeah, so for me, every work that I'm doing is basically about impact. I've seen real life impact in the work I'm doing. I've seen families that are improving because of what I do. And so
Because of Dr. Anderson.
Because of Dr. Anderson, you know. Yeah, so these are things that actually keeps me grounded and motivates me to try and even do more. Because you can't hand out money to someone and it will cause a lifelong impact. No.
Yeah.
But if a father cannot go to work because he can't see, and I'm able to help him see, now he can actually work and take care of his entire family. And possibly one of his kids will become a doctor like me. So it's about the real life impact.
Okay. So thank you very much for being here with us.
Yes.
Right now, a lot of young people are watching us. A lot of young dreamers are watching us. People who want to become doctors like yourself. Yeah, people who are aspiring to do great things in the future.
Yeah.
So if you could put one sticky note on every young person, every dreamer's wall,
okay,
what would you write on it?
Your dreams are valid. Basically.
Your dreams are valid.
Yes. So whatever you aspire to be is possible. The circumstances around us shouldn't limit you. And so if you dream to be an astronaut and you think Ghana does not have an astronaut program here, it doesn't mean you should stop dreaming. There are still opportunities out there. So your dreams are always valid. So just keep working at it. And then don't allow anyone to discourage you.
Thank you once again for being with us. So, dreamers, as Dr. Anderson rightfully said, your dreams are valid.
Yes.
Don't let anything stop you from chasing your dreams.
Yeah.
Thank you very much for staying with us to this point. If you haven't subscribed, please do what to subscribe to Dreams and Feelings podcast, and then get a lot of conversations, many conversations like this. We are on a journey to inspire young dreamers, inspire young people. We haven't gotten anywhere. We are just starting. So we want all of us to start together, be in this movement together, and then help ourselves dream big and then feel together. Thank you very much once again for joining us. And then also make sure to take care of yourself, and then most importantly, your eyes. You can't achieve that vision without a proper vision. Thank you very much.